What's going on, everybody? Dr. Thompson here with Exemplified Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday evening. I just finished up with patients, and I wanted to jump on and talk to you a little bit about some awesome things. You probably read the description, and it says progesterone or birth control and the immune system. So I'm going to talk about that in just a second. I will wait for some people to jump on. If you're jumping on right now, go ahead and give me a thumbs up, say hello, let me know that you are watching and where you're watching from. I always like to see where people are watching from. So today I'm going to talk about birth control and your immune system because I saw some things very interesting clinically. In fact, actually in just the last couple of days. And what I'm going to show you is going to blow you out of the water, okay? If you know anyone who is on any kind of birth control, let me fix that. There we go. If you know anyone that's on any kind of birth control, make sure that you share this with them because there's so many people who think birth control is just some kind of like benign thing and it's safe and it's so effective and it's just awesome and it's just amazing. And I'm going to show you how it literally can cause women to have a very, very bad day when it comes to their immune system especially. And this is not a time of year that you want your immune system to be suppressed, especially. All right. Heidi, I appreciate you joining from Mesa, Arizona, the beautiful state of Arizona. Thank you so much for joining us. Before I go into the topic about progesterone and about the immune system, because what I'm going to show you is going to blow you out of the water, I want to jump on and ask you guys how you guys are doing. If you are participating in the No Sugar Challenge for October, how many of you are participating in the No Sugar Challenge for October over on the Wellness Way Challenge group? If you guys are doing that, go ahead and give me a green heart if you are participating in the Wellness Way No Sugar Challenge for October. Go ahead and give me a green heart. If you want some information on what the No Sugar Challenge is and you say, hey, that sounds like something I might be interested in doing, go ahead and give me a red heart. So give me a red heart. That way we'll make sure that we point you in the right direction. And even though we're about 5 days into it, you're more than welcome to get started doing that as well. Okay. So I am 5 days in. I've been doing, no sugar. And it's really not too bad. All right. It's not that bad. Although I've done it many times. And so the more you do it, actually the easier that you get. Real quick, when it comes to no sugar, there's actually a lab marker that I find absolutely fascinating. In fact, I just measured it about a couple of days ago. I got the results back. So if you go back in the video, I measured my immune system and my different immune system responses. And I also did a no sugar panel and checked some hormone markers and looked at, some blood sugar markers, insulin, A1C, but also there's a cool one and it's called leptin. So you can look at your leptin levels, and this is actually a hormone. It's the hunger hormone, and when you're very sensitive to this is basically when your body has the feelings of fullness and it tells you to stop eating, okay? So my leptin levels are not very high. So what it means is I can release a little bit of leptin and my brain is going to hear it, and if it does that, then I know when to stop eating, okay? Now what's interesting, guys, is the more fat cells you have, the more fat mass that you have, the more that these fat cells secrete this leptin, and the more your brain is exposed to this leptin, so that over time it doesn't actually hear that leptin anymore. And so just like you have insulin resistance, it's called leptin resistance. And so these people who have a high level of leptin resistance, they actually don't know when to not eat. So they don't have this hormone response on when to eat or like when to not stop eating. So these people just hormonally typically just graze and overeat all the time. So this is why at some point your hunger can become a liar. It is not, if you're hungry, eat. If you're not, don't. Because for these people, they feel hungry all the time. And it's just, it's hormone dysregulation, okay? Just like you can get with insulin. You can get the same kind of, leptin resistance as well. So have you had your leptin levels checked? So no sugar is going well for me. Hopefully it's going well for you. And I am going to be doing it for the whole entire month. So feeling good, especially. So I want to go over with you what I'm going to talk about. Progesterone. So birth control and your immune system response. Now, the reason why I'm talking about progesterone a little bit is really there's most of birth controls, whether they're oral, they're implants, whether I stick them directly up the vagina. These are actually usually time released or oral. But the thing is most of them are progesterone based. Okay, and you don't have to look very far to know, if you just understand the physiology of hormones, why this can be very damaging to your immune system. So if you have the Hormone Connection book with Dr. Patrick, he talks about the different weeks of the hormone cycle, or for you to understand your menstrual cycle. Men, it's important for you to understand your wife's menstrual cycle too, because you're going to know how to relate and act to them. But you have estrogen and you have testosterone, you have progesterone, some of the main players in the menstrual cycle. And then you also have, things like luteinizing hormone, follicle stimulating hormone, things like that are stimulating, the release of certain things that are going on. But guys, if you look at basically the third week of a woman's menstrual cycle, is they're going to see a rise in progesterone. So they're going to see this rise in progesterone that's actually coming from the release of the egg, and the remnants of that egg is releasing this progesterone. And so the whole idea of this progesterone is to maintain the tissue within the endometrium so that it can be maintained just in case there is a pregnancy, so that the egg can actually implant. Absolutely fascinating, that this is actually happening. But also during this time, this is when in this third week, women typically don't feel so hot. They start noticing things like bloating. They start noticing also, this is another part where you're going to see that the immune system starts to go down. And the reason why this happens is the immune system goes down is that if an egg is fertilized and the egg implants into the endometrium, then this makes sure that the immune system doesn't kill the egg. Because remember, that fertilized egg is still 50% of DNA that's not yours. So this is why you're going to get some immune system suppression during that third week. Now, the other thing is during pregnancy, you're going to see very high progesterone as well. And if you see very high progesterone during pregnancy, you're also going to have some immunosuppression. The reason why is so that pregnancy can get carried to term, and the immune system doesn't bombard that fetus, because again, 50% of the DNA is not yours. It comes from dad. So progesterone in and of itself is actually an immune system suppressant. This is very important for you guys to understand this, because maybe your daughter is on a birth control and you think nothing of it. Maybe you're on birth control, you think nothing of it. Birth control is not benign. It is not like, it's no different than just taking a vitamin. Because I'm going to show you something when it comes to these different things, all right? You guys ready? All right. Probably can't see this very well, but one of the things I'm going to talk to you about, because I had a patient who came to me. She was absolutely scared to death. Absolutely scared to death. And the reason why is that she started her menstrual cycle at 14 years of age, and by 15 was already put on birth control because she didn't have a normal menstrual cycle. So the doctor just said, didn't measure any hormones, you're just going to be on birth control. Here's her birth control, let me know how it goes. All right. So the thing is that when you realize that long-term birth control will absolutely long-term devastate the immune system. The reason why I know this is that she's a very young girl. She's very young, and an HPV infection has turned into precancerous cells on her cervix. Okay? Not good. So think of, someone who's very young with already precancerous cells on her cervix, in which they have to actually scrape off. Now, why is that? Well, just remember, HPV is a virus, and you have to have a strong and adaptive immune system, specifically things like natural killer cells and CD8 cells, which are in and of themselves designed to handle any kind of virally infected cells or cancer cells. This is why you see a virus and a cancer connection between the two. So she was taking, for the longest time, she was taking some level of birth control. In fact, the one that she was taking most recently was called Kyleena. And I looked at this and I saw, this was an implant. And I thought, well, let's look at this. Let's see what's happening. Why this woman, so young, is already having precancerous, basically pre-cervical cancer already take place. So if you actually go and you look on the website of Kyleena, this birth control, here's what they say. Number one, this is what's amazing. They say Kyleena is thought to work in several ways. All right. Now, I look at that and I'm going to pull a Dr. Patrick Flynn here. Hold the phone. Wait a second. You mean to tell me they actually aren't certain on how it works? They actually say it's thought to work. Talk about the ambiguity in a medication that they are approving for hundreds of thousands of women, is that they really don't even know or for sure on how it works. This actually goes the same for ADHD medication. Go on their own website and they'll say, well, we think it works like this. You mean to tell me that we are going to manipulate a woman's hormones or manipulate a child's brain only with the assumption that we think that it's working? I would want to know exactly how it works, but they are saying we think that it works this way. Okay? Now, Kyleena, it actually gives you a continuous low dose of progestin. What is progestin? It's synthetic progesterone. Okay? So, when you look at this, you're taking a low dose progesterone. If you keep looking at this, here's what they say. 22% of women actually will develop cysts on their ovaries. 22%. 1 in 5, greater than 1 in 5 will develop cysts on the ovaries. And the reason why is because if you elevate that progesterone, you are going to have the development of a follicle, of the actual egg, and it won't actually get released, and then it persists and then develops into a cyst. Okay? In fact, some of them actually need to have surgery. All right? What's interesting, though, is you get off of the birth control and the cysts actually disappear. But this is what I found interesting up and through here. I don't know if you guys can read that, so I'll read that for you. And here's what they say. They say important safety information. If you have a pelvic infection, okay, or you get infections easily, or if you have certain cancers, don't use Kyleena. Less than 1% of users get a serious pelvic infection called pelvic inflammatory disease. But here's what they say. They say if you have a low functioning immune system, please don't take this birth control. And how do you know if you have a low functioning immune system? Doctors aren't actually testing it. We test it all the time. And you can test your immune system response. So the doctor actually put her on Kyleena. And at the same time, we know that she's got a low functioning immune system because she's developing precancerous cells, which is a direct function of natural killer cells and also CD8 killer T cells. So if you are having an infection or that is persisting and it's growing and getting worse, we know that your immune system is very low. Why do you keep taking a birth control? And it doesn't make any sense. So remember, progesterone decreases the immune system response. Who says so? The manufacturer. The manufacturer actually says that it will decrease the immune system response. And if you're having infections or cancers, or it should say precancers, then guess what? You don't need to take it. I actually told this patient this, and she went back to her doctor and said, I think we need to get off of this. And in fact, I think I need to get off of all birth control. And the doctor said, well, wait, what do you mean? You don't want to get pregnant? Maybe you should do a different birth control. And she said, you know what? I'm done, because you should have told me about this a long time before, but you took my health and you put it at risk, because look at what I am dealing with now because I've had immunosuppression for so long. Okay? So think of this. This comes from WebMD. Look at the side effects and the safety of taking some kind of progesterone based birth control. All right? Look at what they say. When taken by mouth, it is likely safe. When applied to the skin, it is likely safe. When it's given as a shot, Depo-Provera, it is likely safe. when applied into the vagina, like in this one I just talked about, it is likely safe. So they're not saying it is safe, 100% safe. They're saying, well, it's likely safe. And remember, they actually just said, they said right here that it's thought to work. You guys see the ambiguity. Well, it's likely safe, it's thought to work, and we think that medicine is scientific. Oh, it drives me nuts. Okay? So, likely safe. However, if you look at the bottom, here's what it says. Progesterone can cause, now watch this, many side effects, including stomach upset, changes in appetite, weight gain, fluid retention, swelling and edema, fatigue, acne, drowsiness or insomnia, allergic skin rashes, hives, fever, headache, depression, breast discomfort, premenstrual syndrome-like symptoms, altered menstrual cycles, irregular bleeding, and, okay, other side effects just to cover our bases, okay? Now, this is what's interesting. Just this week, I've had 2 young women who have come to me, and they have said, you know, I think I have a lot of food allergies. I'd like to get food allergy testing, and oh, by the way, I'm taking a birth control. And I said, well, just so you know, do you know what the side effects of being on birth control are? Do you have stomach upset? Yes. Do you have changes in appetite? Yes. I'm not hungry. Have you had weight gain? Yes. I feel like I'm bloated all the time. Are you fatigued? Yes. I feel like I'm just tired all the time. Maybe it's my adrenal glands. I am having changes take place in through my skin. I get headaches. Oh, and I feel depressed as well. Guys, the first thing a doctor should actually look for is not what tests they should start adding. They should actually look at their medications and say, you know what? I think you're having a reaction. I think these are some unintended effects of being on these drugs, medications. So the first thing I told them is yes, we can test your foods, but guess what? It is likely that being on a progesterone-based birth control is actually causing it. Guys, your job as a doctor is to figure out what is wrong and what is interfering first, then figure out afterwards how to actually support the body, okay? But yet I asked them, did the doctor talk to you about that these were some of the symptoms that could happen? They say, never, no, not once. They just said, take it and just follow up in a year, okay? Now, reason why I know that this can cause immunosuppression is for one of them that was taking a progesterone-based birth control. We actually tested their foods, and we saw that someone with tons of bloating actually had 5 food allergies, and that's it. So you know that there is some level of immunosuppression taking place if you're getting lots of bloating and food allergy type symptoms, but you're not seeing the reaction take place, which means that, remember, the B lymphocytes are the ones that are making antibodies. And so if your B lymphocytes are tanked, you're not going to be able to have an antibody response, yes, towards any kind of antigen, whether they are a food, whether they are a virus, whether they're a cancer cell, whether they're a bacteria, a fungus, whatever it might be. So guys, birth control is not benign. It is not just, woo, let's go ahead and take this and I'm going to have this incredible life. It causes so much collateral damage, all right? Now I want to show you something. This comes from PubMed. Where'd you get this, doctor? Did you look at it on the internet? I did, by the way, and you get it from PubMed.gov, the National Institute of Health, and anybody can look up at this. This is what I love. I love that literally you, as a layman, can look up the same research that I look up, and it's no longer the doctors on their ivory tower that are saying, you don't know anything, I'm the one who knows everything, because you can actually look up and you become more research than the doctor itself. Heck, sometimes I've had patients say, hey, what do you know about this, whatever condition? And I'm like, honestly, I don't know, but I can look it up. So, because guys, we're always researching. And any doctor says they've known everything about everything, they're lying to you. So this comes from PubMed, all right? Here's what it says. The effect of progesterone on the immune system, all right? The effect of progesterone on the immune system, okay? Here's what they actually said. Progesterone takes part in avoiding immunological aggression of the maternal organism, just like we said, and the semi-allogenic concepts by suppressing specific components of the immune system. Okay, so the reason why the immune system is suppressed is to make sure that it's not attacking the actual fetus, and how it does that is it actually suppresses what's known as natural killer cells. Natural killer cells. This is what it suppresses. Natural killer cells. The very thing that's responsible for viral infections and the very thing that's involved with cancer cells. Okay? You already have an inborn protection. So what happens if you suppress that for years? Let's say you get some kind of viral infection. Let's say you get the human papillomavirus, HPV. Let's say you do get it. Guys, if your immune system is normal, your actual immune system can handle it. So it can kill those virally infected cells and you're good. But what happens if you're chronically immunosuppressed? Those viral cells keep infecting more and more cells. And remember, where it actually attaches to, its method of infection is actually within the cervix. Okay? Some viruses, the method of infection is through the lungs. Some viruses, the method of infection is through the gastrointestinal system. But when it comes to HPV, the method of infection actually comes from the cervical mucosa, those cells. So, high doses of progesterone, guess what? It suppresses natural killer cell activity. Okay? Now think about this. What if you have been on birth control for the last 15 or 20 years? Your immune system has been suppressed. And what do you think? You got to be worried about cancer. You got to be worried about cancer. Who says so? Physiology. Physiology. Understand how the immune system works and understand that you suppress it long enough, you got to be worried about cancer down the road, especially. So hopefully, guys, that makes a lot of sense to you. All right? Let me know what you think. Make sure that you share this with people that you know that are on birth control. Please, please, please. Because it's not just, all it is manipulating hormones, creating another hormone imbalance for a hormone imbalance. But it's not just that, it's much more. It comes down to the immune system. And it comes down to suppression of the immune system, which has long-term devastating consequences. So I hope, guys, this makes a lot of sense to you. And again, please share this with other people, especially that are taking birth control. Please, I implore you. This is why we put out great information every Monday, so that we can make sure that we're teaching you, that we're serving people, and that we're saving people's lives. So again, no sugar. We went over that, and we went over progesterone-based birth control and about how it suppresses the immune system. So guys, maybe I'll jump on Wednesday and go over my immune system panel. I did that just finally got the results back, and I'll go over my immune system panel, and I'll go over with you some holes in my immune system, especially, and I'll share it with you. I got some holes, and hopefully you know what your immune system panel looks like as well. So again, my name is Dr. Nathan Thompson with Exemplify Health Center. Always appreciate you guys being on. I appreciate your kind comments. Guys, make sure that you have an awesome evening, and we will talk to you guys very soon. Be well.